Hello friends, if you haven't yet subscribed to the channel, it will be a good time to subscribe now. Hello friends, this is a quick MCQ on artificial respiration. So let's see the MCQ. A middle-aged man suddenly collapsed while boarding a flight. Medical personnel was called, and the person, maybe a doctor, he found out that the pulse rate was 110 beats per minute, but there were no respiratory movements. So what should be the immediate action? That's the MCQ. Simple one. Maybe you will be able to guess the answer. Wait and watch, or maybe call for an ambulance, or external cardiac compression, or cardiac massage, and mouth-to-mouth breathing. What is the most appropriate action that can be taken immediately? Well, this is only an MCQ. This is for the sake of MCQ. Every possible action should be taken to save the life. That's the underlying principle. But then, given the situation, what would be the best option? And the answer is mouth-to-mouth breathing. Why? Let's check out. Yes. Look, mouth-to-mouth breathing is the artificial method of respiration. It is the assisted breathing. So when do you give cardiac compression, external cardiac compression, cardiac massage, and when do you give mouth-to-mouth breathing, or both of them can be given simultaneously? Yes, they can be given simultaneously as well. It's called CPR, cardiopulmonary resuscitation. But technically speaking, if the circulation has stopped but breathing is going on, then the preferred action is external cardiac compression or cardiac massage. That's the part of CPR that is preferred. On the other hand, if breathing has stopped but circulation is going on, now if the circulation is going on, then there is no need to give cardiac compression. Cardiac compression is given to revive the heart. If the heart has stopped, circulation has stopped, it's not happening, then you give cardiac massage. But if the circulation is going on, as in this case, pulse rate was 110 beats per minute, that means circulation is going on, heart is functioning, only breathing has stopped. In that case, the preferred action immediately would be the mouth-to-mouth breathing. Breathing has stopped, and therefore the attempt should be to revive the breathing. Now there is something that needs to be understood about the mouth-to-mouth breathing. Many students believe that mouth-to-mouth breathing delivers oxygen to the patient. Well, it does deliver oxygen to some extent, but that's not the purpose of mouth-to-mouth breathing. Many students wrongly believe that because breathing has stopped, you need to give oxygen, and that is what you are doing. No, that's not the purpose of mouth-to-mouth breathing. The purpose of mouth-to-mouth breathing is to deliver the carbon dioxide into the system of that subject, of that patient. Yes, and why is that? See, you are exhaling out the air into the respiratory apparatus of the subject, and expired air obviously will contain a lot of carbon dioxide. It does contain 16% oxygen as well. But it is the carbon dioxide delivery that we are looking at. Why is that? Because since circulation is going on, as we said, breathing has stopped, but circulation is going on. This also happens at times. If that is the case, then you deliver carbon dioxide into the subject's system. Because the circulation is going on, this carbon dioxide will enter the bloodstream, and via circulation, it will reach the brain stem. In the brain stem, there is respiratory center, and you know carbon dioxide is a very important stimulus to the respiratory center. It stimulates respiratory center via central chemoreceptors, and thereby it stimulates breathing. So it means there is a possibility that it will stimulate the carbon dioxide will act on the respiratory center, it will reach there, and it will stimulate the breathing, and breathing will start. So purpose was to initiate the breathing process, and the purpose was not to deliver the oxygen. So that distinction should be made. Although some amount of oxygen is also delivered in mouth-to-mouth breathing, 16% as I mentioned. But the effort is to start the breathing, and that is by stimulating the respiratory center. And that is possible because circulation is going on but breathing has stopped. So that was a simple MCQ, but with a small little concept that needs to be understood regarding the mouth to mouth breathing.